Welcome to the Sixth Wheels Consulting Podcast, dialoguing disability and discussing difference, inclusion, and all abilities in today's world. Now here are your hosts, Matthew Shapiro and Bob Nolly.
Welcome back, folks. How are you? Come on in, have a seat. Matthew's here. This is Bob Nolly. And here's your host, Matthew Shapiro. How are you, Matt?
I'm great, Bob. How are you, sir?
I'm okay. We were talking. We had just had a great conversation previously about the workplace, and tonight let's step out of the workplace and let's step into the hospital. Really?
It's sort of the workplace. If you work there.
Yeah, it's somebody's workplace. That's for sure. Somebody was making the point to me that he was in his 30s when he came home from an appointment with a new primary care doctor. And notice now he says, new primary care doctor. We should just say, I went to see my doctor. Now it's my primary care doctor. The kind who has an app you download to schedule appointments. What the heck? And you can get him on a conference call for, if you have a cold or something like that. So, he came home and he told his fiance about the experience, and the doctor was familiar enough with the syndrome that he was being diagnosed for. She didn't have to Google it. She sent me home with a slew of referrals, and she gave me the answers when she could and promised to follow up when she couldn't. So that's he felt great about that. For once, the complications of the disorder he was facing, which is the Ehlers-Danlos syndrome, didn't frighten the doctor away. He just found a plethora of material on it and a couple of points she couldn't find. She said, I'll get them back to you. But then he went back for a visit later. And he said, hopefully you don't think I'm unprofessional for saying this is the quote, but I feel like we've really developed a rapport. I also have a hypermobile, the same syndrome. It's not as severe as yours. But my caseload, the stress I have on the job have caused serious flares, and I'm stepping away from medicine for a little bit because it's just a bit too much for me. So here you had somebody that just gave him not only great care, I would say great care, at least a rock solid diagnosis, and a ton of material that enabled them to go find out more about this syndrome. And when you went in for a follow-up, you're excited about that. Going to the doctor's office is not something to be excited about.
Sure.
And then you get the word, you had to call it quits. You see, he put it right out this way. He says his heart crashed and burned.
Well, I mean, it's so interesting because I feel like, one of the more sort of frustrating experiences for me is going to the doctor. Not only because of the physical barriers that brings about, but oftentimes, doctors don't really, they know about my disability because they've heard about it in a textbook or they've heard about it through their studies that they had, but they can't relate, right? And so this article, I think, really helped to, I think the doctor showed empathy, and I think the doctor showed a strong and clear understanding of the disability that the patient was dealing with. And I think we should strive to try to have more doctors with disabilities or more people with disabilities in the medical profession. I know that I've recently seen, there's a doctor somewhere, I can't remember the state, but it's a surgeon, and the surgeon actually performs surgery from her wheelchair. I think it's a her. I'm pretty sure it's a her. Let's say their wheelchair, so that we're not being unclear, but they have a standing wheelchair and they're able to perform surgery from their wheelchair. And I'm seeing a lot more instances of people with disabilities being doctors. And I think things like that could help to ease some of the anxiety and fear that comes from going to the doctor's office.
Yeah, that's here's what's happening. When we see, at least this is the way I've internalized it for decades. This is me personally. When we put doctors on a pedestal and we see doctors, particularly when we're younger, as infallible. When you have a bad event somewhere down the line, all of a sudden they're not infallible anymore. But I think for most of your life, you see them that way because you see them, they're wearing the white coat and you made the assumption of the degree or degrees that are behind that and the knowledge of the places that they've been. And you elevate them into a position of very high action and super high knowledge. And we know that medical school is absolutely grueling. But at the same time, we also think that doctors are always at the peak of health. They are models of wellness. So we put them on this pedestal of perfect knowledge and support and everything that they stand for. Oh, and they always have to have perfect health. And Lisa Izoni at the Mongan Institute Health Policy Center, she said the medical profession historically has viewed themselves as able-bodied in the extreme.
Sure.
And there are problems with that. First, people with disabilities are far more capable than typically presumed by other people. Well, we've been talking about that for 25 episodes.
Yes.
Okay. Second, accomplishing a task, getting something done in a way that differs from how a person without disabilities will do it, that's not failure. That's not the same thing as failure. That's getting the task accomplished.
Sure.
And there's no doctor, disabled or not, who's capable of doing all medical tasks. That's why they have specialists.
Sure. And I see many specialists myself. Like, I have a kidney doctor. I have a spine and bones doctor. I have an eye doctor. I go to many specialists. And so maybe they're not the surgeon, but maybe they could be a doctor in another specialty. And I think, again, they'd be able to show a level of being able to relate to the patients and understanding the challenges that their patients might be facing.
And the disabled have done every incredible thing humans without disabilities have done. They've been presidents, senators, actors. We talked about that. Olympians, Paralympians, dancers, musicians, inventors, theoretical physicists, mountain climbers. You name it, they've done it.
Sure.
Just not the same way people without disabilities would. So where does that leave us with the doctors?
Yeah. I mean, I think it comes back to we have to see more people in those roles. And I think that's why, I'm so actively pushing on this podcast and in the work that I do that, like, don't stifle someone's desire to do a thing because they have a disability. If somebody wants to be a doctor in some specialty, maybe they won't be able to do the surgery aspect on a regular basis, but they can do something in the doctor field.
Yeah, nobody expects your primary care guy to be able to do cardiac work on you there in the office.
Sure.
But here's the deal. In a survey that NPR did, 1,500 medical students in the U.S., 1,500 medical students in the U.S. have disclosed a disability to receive accommodations for that disability. That's just under 3% of the students.
Sure.
Now, that's lower than the 11% average we see for everyone else.
And I wonder honestly if those disabilities are more learning disabilities than physical disabilities.
Yeah, it could be. Many of the students hide their disability out of fear of judgment, bias, and skewed perception of their ability.
I feel like we've heard that before on this podcast, huh?
Don't you think? There was a 1994 study, speaking of prejudices against disability, that 22% of clinicians reported they wouldn't want life-sustaining treatment if they experienced the spinal cord injury, and 41% said they felt their ER staff tried too hard to resuscitate or save patients with spinal cord injuries. Wow.
Yeah, and there's an interesting debate within the spinal cord injury community, as everyone knows. You know, I have CP, so but I know a lot of people with spinal cord injuries, and there's often that conversation of you know, would you want to go back to normal? And I've heard it both ways from all different types of people. So there's often that debate even within just that community.
Yeah, you know, here's something that will probably lead us to the final word here. Physicians with disabilities share lived experience that can inform more competent care for their patients with disabilities. Let's make sure everybody hears this. Physicians with disabilities share lived experience. They have experiences they can share that can inform more competent care for their patients. So if you're working alongside doctors with disabilities, doctors without disabilities begin the process of learning how to properly treat and interact with people with disabilities. Have you been in a position to experience that?
Oh, I can't tell you how many times like the interaction with doctors is awkward because you know they don't know how to have that interaction. You know, oftentimes we talk about how the medical challenges are mostly based on the physical challenges, but I would argue a lot of the challenges actually come from doctors not knowing what to do and not knowing how to adequately interact with people with all different types of disabilities. And, you know, again, they only understand their disability from what they read in the textbook, and they don't know how to take it and translate that to, holy moly, this is an actual person that has challenges that I need to be aware of when I'm considering, you know, a treatment strategy or anything like that. So, yeah, so often I run into those awkward conversations with doctors, and think that there's a lot of work that could be done to make the interaction piece better. Because, like I said, I think that's where most of the challenges actually come from, and not the physical barriers that we talk about all the time.
Yeah. So here's the deal. You know that you germinated the whole thing right there. A primary care doctor who shares your diagnosis, that's living the life you are living, will inarguably have a better understanding of your life experience than any doctor who is not disabled ever possibly could.
Sure.
So,
exactly.
You know, we spent 25 weeks now talking about how disability is not a tragedy. And here's the word inclusion again. Inclusion, it should extend into the medical workforce.
Agreed.
Wow.
Agreed. It's, you know, it's so funny. These articles and these things that you and I read on a week-to-week basis and find just re-emphasizes and reinforces, you know, why our podcast is so important. And I continue to hear all of the messages that you and I talk about on a regular basis, and that just that makes me so happy.
It's a great thing. It's a great thing. And I'm so glad to be a part of you being able to get this message out.
Sure.
So folks, now it's time to pay the bill. No, you don't have to write us a check. Well, you could, I guess. Matthew will take it. Yeah.
You could.
But he will. Go to iTunes, Apple Podcasts, to the Six Wheels Consulting Podcast, and leave us a nice 5-star review and a comment there. That really helps get the podcast out in front of more people in the Apple Podcast world. So
Sure.
think about that. Go to the Facebook page and leave us a blurb there. Ask us a question. Let us know what you think. Because, yeah, we're doing this for a lot of reasons, but at least one of these reasons is you.
Yes. We want to help educate all of you. Exactly.
Right now, go do that right now.
Yes.
I'll wait.
Yes.
I'll wait just a minute before I wrap up. I'll wait.
And we're also, I also want to reiterate too, we're also on other platforms like Stitcher and SoundCloud and Podbean. So there's multiple, although our iTunes is our first go-to because we really want to get your feedback on that. If you don't have access to iTunes, we're in other places as well.
So maybe we should rename. Have you thought rebranding your businesses into Matthew Shapiro Omnimedia?
I could.
Would Martha Stewart allow us to do that?
There you go.
All right. Ladies and gentlemen, you've been listening to the Six Wheels Consulting Disability Podcast. This is Bob Nolly for your host, Matthew Shapiro. Think inclusion and keep rolling forward.